Hi everyone, welcome to the 6th episode of the Crackdown. So my name is Xuan, or some of my patients call me Sophia, and today I'll be the host. I was here on the previous episode, honestly did not expect to be back so soon, but here I am, and I have a very special guest with me, Zul.
Hello guys.
Yeah, so Zul, can you tell us a bit about yourself?
So my name is Wan Zul. People call me Wan or Zul. And yeah, I'm a physiotherapist in Relief Chiro.
Which do you prefer actually? Because everyone at work, right, we call you Zul, but I hear you introducing yourself as Wan to certain patients.
Either I don't mind. Wan or Zul, up to you. Yeah.
Right. So how long have you been a physio?
So full time, I've been a physio since June this year. But as a part time, it's been 3 years plus in Relief. But other places, so total everything has been like what, 4 years, yeah.
Right, so quite a lot of experience under your belt also.
Yeah, I could say, yeah. Plus I do a lot of house calls also.
Right, okay. And I'm sure you have a lot of interesting cases, a lot of drama that we can dig a bit into later.
No, not really.
Yes, got. Don't try to cover up. I'm sure there is. Okay, so how did it work actually? Because you were working part-time and studying at the same time, or?
Yeah, I work part-time on the weekends and study full-time. Yeah.
Well, that's amazing. You can juggling between both.
It was killing me, but survived.
Yeah, do you feel like working part-time on the weekends helped you with your studies also? Just curious.
I'm just in it for the money.
Okay, so the other kid pays quite well, huh?
She does. Plus, because like when I was taking my degree, I'm already like what, 25, 26. So it's quite late. So I need to catch up. So I have to earn something. Yeah.
But do you feel like working part-time and then now full-time, do you feel like working part-time has helped you with your current work practice now?
Oh yeah, it does. Yeah. Now I'm working full-time. It's more smoother. Yeah, everything is more smoother compared to how I first started.
And where do you study physio?
I studied in INTI. It's in Nilai.
And it's a 4-year course.
4 years, but for me it was 3 years because I have my diploma, so I got to skip.
Right, so you had a diploma in physio first, then only degree.
Yeah.
Oh, I didn't know that.
So I got 2 diplomas. The first one is in aircraft engineering, and the second one is in physio.
Yeah, completely different fields. How did you manage to switch right over?
It's quite tough, but just because I keep thinking of what age I'm gonna graduate, you know. Yeah, so but just go with it.
Right. And have you always wanted to be a physio, or was it something that triggered you?
Something that triggered me.
What inspired you?
When I was studying my aircraft engineering, I was into going to gym and stuff like that. And back then I got fit, and people around me started to ask how did I do it, and I teach them right now how I did it So I teach them, train them. From there I like how it feels. So yeah, that's why I started doing it. Like I was planning to just take personal training course, like coaching course. But when I think about it, long term it's not going to be good for me. I don't see how I'm going to grow from that. So that's why I start going to physio, so I can learn more about the human body and use exercise as treatment. Yeah.
And I feel there's a lot of fitness instructor nowadays that also have physio background. Yeah, so maybe in the future, if you want to transition also, you can.
I do have personal training certificate even before or after I done my diploma. I forgot. But yeah, I do have it.
Actually, even in the center, right, a lot of for me personally, a lot of my patients that are very fit or very fitness junkie, right, I also tend to refer them to Zul, because Zul has a very good understanding of exercises, and he's very creative with the exercises also. So that's a very good thing about his type of treatment.
I don't think so because when I just being original. Just being original.
Yes.
Because when I have a friend, like few friends in other centers, when I see how they prescribe exercises, it's much more creative So I want to learn more. I don't feel like I'm enough, but always hungry for more knowledge. Yeah.
Yes, that's a very good mindset. Yeah, so for someone that has no clue about what physiotherapy is, how will you describe that in your own words?
I would say what physiotherapy is someone that's specialized in movement. So when patient comes with problems, pain, or they feel discomfort, we will analyze the movement, how the body moves, and see, because when we move, not just one muscle is working to move that part. There's a bunch of muscle that works together to cause the movement. So when patient come with problems, we analyze the movement and see what's lacking. Like we will do a bunch of tests and stuff like that to see which muscle is working, which muscle is not working. Then from there, we give our intervention lah.
And so what type of intervention do you give?
So normally people think that physio only do massage.
Yeah.
I just jumped in.
Yeah.
It's just do massage, but that's not it. We use massage as a tool. We have a lot of manual therapies like dry needling, cupping, fascia release, massage, or we call it as STM, soft tissue manipulation. Those are the tools that we use. And also we do prescribed exercises for patients. So we don't just rely on massage. We also mainly rely on exercises. Yeah.
And it's not like when one patient comes to you with back pain, do you do all of the treatment, or you pick and choose which one is suitable for the patient?
I pick and choose what's suitable for on that spot, like what's going to help them on that spot. If exercise, when I assess an exercise I see is more beneficial for them, then that's exercise. If I see that massage is going to help, then I do massages. Yeah.
Right. And I think recently you and Jess, you guys went to take the dry needling course as well. Yeah. So how was it? Have you applied yet to your patients?
Yeah, I applied it to my patients already, and it's quite fun and scary.
No, guys, it's not painful at all, guys. Don't let him scare you. I tried. It's okay.
Joking. It's fun lah. For me, it's fun to just poke around the muscle. But yeah, what we learn is a different kind of dry needling. It's not like those trigger point dry needling. It's I forgot the name, but it's to break the fascia.
What is fascia?
So fascia is what's around our body, like the muscle. Okay, so if you cut a cut a chicken before, and you see the like chicken breast, and you see like this white membrane, thin membrane that covers the muscle, the chicken breast, that's fascia. So yeah, it covers your whole body. So there's a system for it. You know, the fascia system. Yeah. So because when we move, like I said before, not just one muscle that's moving, it's a bunch. So the fascia system is what connecting all the muscle to work together. Yeah.
So let's say if one area of the fascia is tight or stuck, for example, it can affect the whole chain of movement.
Yes.
Yeah.
It does.
So what dry needling does is basically releases all this tension.
We break it and also release it. Yeah. Cause more healing lah.
Okay. And how many sessions do people usually need for dry needling?
Depends. It's either they want trigger point or they want fascia release. If trigger point, normally one session is enough. They feel sore right after maybe 2 days, very sore, but not painful, just muscle soreness. But yeah, one session will be enough. But fascia breaking, like breaking the fascia, a few sessions, but after one session can see the difference already. Yeah.
I think what's the good thing about dry needling, right? Based on I think how my patients' experience is that with one session you can see a very big difference compared to like manual release.
Yeah.
Manual release probably take 5, for example. Dry needling probably take 1 or 2. Then the result is already there.
Correct.
Yeah. So how is dry needling different from acupuncture? I think a lot of patients ask this.
Acupuncture, for what I know, is they target more of your chi point, like the TCM. How the school of thought is different. Yeah, they aim for the chi points, but for trigger point, they aim for the muscle itself. Yeah, so you insert the needle inside the muscle to break the trigger point.
I've personally tried dry needling with Zul before. I honestly don't feel any pain. When the needle goes in, I don't feel anything. But there are times where you hit something, I think it's the trigger point, and my muscle starts to twitch. Why is it that way?
When your muscle is tight, they have this, what they call like knot that build up. Your muscle fiber starts to clump up. Like get tangled up. I wouldn't say tangled up, that's the wrong term. But yeah, it's like
I think how I would explain, right, is that our muscles are like hairs or strands of hair, right? And the muscle fibers are like strands of hair. So one muscle bundle that has a few fibers that actually intersect. So when the muscle lengthens, for example, biceps, if you lengthen, it will elongate. But when you contract, it will overlap. So when the muscle is stuck in a contractile state, that's when all these trigger points starts to form.
When twitching happens, it releases. That's when the muscle release happen. But also, when we do trigger point, right needling, we don't really like chase for the muscle twitch. Even without the muscle twitch, release still happens. It's just that as a physio, we find it's more addictive when there's a twitch.
You guys are just like to torture people. Okay, so I think then before you did a dry needling, right, you and Zach, you guys went for the cupping course as well?
No, I mean,
was it you?
It's Jess and Zach.
Oh, Jess and Zach did the cupping. So, but do you also have a brief understanding of cupping, right?
Because during my other part-time job also, we had cupping. So from there, I really like how it really works. So I bring it to Relief Chiro. But we have to figure out how to make money out of it. So yeah.
That's why she sent Jess and Zach for the course.
Plus, for what I know, for Chiro, you guys have to have the certificate to practice, right? For cupping, even something like that.
Even dry needling, you need certification to practice. Not just anyone can do it.
So, but for cupping is safe lah.
So cupping's goal is also to release the fascia, or?
Again, there's a different type of technique for cupping. There's dynamic and there's static. Static is what we normally see, where we use suction to just make it stick on the skin and just leave it for like 5 to 15 minutes like that, and that will help to increase the blood flow in that area and causes muscle relaxation, and also help to give like separation in the muscle and the fascia. But for dynamic, it's where we move the cup. It's either we move the cup or we move the limb. So that one is to release the fascia.
Yeah, so for those that don't know, we actually have a new service called dry cupping. Dry cupping is
dry cupping.
Yeah, dry cupping therapy. So anyone that's interested to try, you can also visit our center. So since I'm a chiro and he's a physio, and we're here together today, we would like to debunk, or at least let people understand better what are the differences between our profession and who you should visit if you are feeling unwell. Yeah. So for physios, what do you guys? So sorry, for in your own words, how will you differentiate between chiro and physio?
In my own word.
If patient come in to you, why should I see you? Why can't I just see a chiro?
Most easiest way to make them understand is that physio, we focus on movement and muscle. And chiro, if I would have to explain to them, focus on joint and the spine and also the central nervous system.
Yeah, I think for us, because our center provide both chiro and physio treatment, a lot of patients that come in, they will usually do a consult with the chiro first. So with me, when I see patients, I'll do a consultation, I'll get to understand their case a bit better, and then try to narrow down the condition to a few working diagnoses. And then from there, we'll do a few orthopedic tests, assessment, check the muscle movement, the joint movement and everything, and then decide what is the best course of action, whether or not the patient needs to see physio or whether just a chiro is enough. Because for most cases, right, chiros in the market, we do have some minimal experience in treating basic muscular work. Yeah, like generally soft tissue release, or some chiros even have experience in dry needling. So basic stuff we do know when it comes to muscles, but when it comes to a bit more advanced or a bit more diverse type of treatment plan, then usually the physio will have more expertise in that. Yeah. So for us, chiro, long story short, we focus more on the joints, the posture, and the alignment between the muscles and the joints. So our goal essentially is to ensure that the joints are moving as it should, so that it can function at its best. So you have a lot of hobbies outside of work also. Like for Zul, he likes to do Muay Thai, he likes what else?
But I haven't been doing Muay Thai for quite some
He
time.
likes surfing. I'm trying to boost your
Okay.
profile. And recently you just went to a surfing trip twice already in the past 6 months.
Is it? When was it? No, camping. I was camping at the beach side and go surfing also. Yeah, I love outdoor.
Yeah, he's very outdoorsy. He likes nature. Yeah, I think you mentioned before also, like in 10 years time, you don't see yourself working in a in a clinic, right?
Yeah, I know.
Yeah, your end goal is to open
My own place.
Yeah.
Beach side. Yeah. So my own.
Yeah.
Because I love going to the beach, and that's my place. And I want to open my own center right at the beach. The scenery.
The scenery will be different.
That's all. Just the beach is more calming, you know. You see the water, the sand, the sun.
No, but I'm pretty sure the patient dynamic will be different also.
Yeah, patient dynamic will be different.
Yeah.
For me, I would aim for like surfer. Maybe focus on rehab and performance for the surfers, and also gives like those yoga retreat also package for people that want to do yoga. And no, I'm not. Just for money, maybe. Just introduce the service.
The whole wellness center,
Yeah,
holistic
wellness
care.
center, yeah. But also, while doing that, focus on the local also. Give more benefits for the locals. Yeah.
But do you feel like being an active person yourself, has it reflected in the way you treat patients in your
I would say kinda, because I could relate to how they are feeling, the pain. So once if they come with tennis elbow, knee pain, hamstring pain, I felt that before, so I can relate how it feels like. So from there, I can really know how to deal with that for them.
But do you have any interesting cases, like based on your working experience?
Interesting cases, just in relief or
Anyway, throughout your career, your 4 years career?
The most interesting cases I've seen is in hospital, but those are not interesting. That's scary for me.
Why scary?
Because hospital cases, like they got different department and different level is different ward. So sometimes you are placed in, I forgot what's the ward called, but those critical patients or ICU.
ICU patients.
So sometimes, got one patient, she was really, not sensitive, really critical, memang bedridden for months. So I have to do some joint movement for them to keep their joints loose. So when I move for them, suddenly their BP, everything drops.
Oh no.
Yeah, that was scary. Yeah.
Suddenly, red call.
No, I just call for the nurse. They say, okay, it's normal. Okay, then okay lah. But yeah, it's quite scary for something like that.
Yeah, I think for a lot of people that don't know, physiotherapists, you guys are actually, when you're still a student, right, you're actually placed in different hospitals, in different departments. So their knowledge when it comes to treating cases, right, is not just narrowed down to MSK. It's actually a diverse type of condition.
Yeah.
It's just that now he's working in relief, so the cases he sees is all MSK. Yeah, but you do have a few stroke patients as well, right?
Yeah, that one I do my own house call. Yeah, so yeah, I have a few stroke patients.
So if you go to the patient's house to do house call for stroke patients, do you need to bring a lot of equipments, or you just?
Not really, just cuff, the ankle weights, some bands, some the board. Foam board for stability is enough to do a lot of stuff already. Yeah, if they have their own gym at home, like those condos, then that'll be easier. Or staircase, that'll be enough.
Is working in relief the first time you've worked closely with chiros, or?
Yeah, first time.
First time, So what do you think, which type of cases do you think benefit best from chiro and physio collaborations?
In MSK, generally everything.
Generally everything?
Yeah. If it's MSK, then for chiro and physio will be beneficial for them.
Yeah, because I've worked at centers where we just do chiro, like it's just a pure chiro center. We do adjustment and a bit of physio work here and there. When I've noticed that when I worked with physios in collaboration, the result is a lot better. Not only they experience improvement a lot faster, we can also manage them better post-pain management. So meaning once the acute pain phase is gone, we have to work a lot on strengthening certain muscles to help stabilize the whole system. And I think that's where physiotherapists come in.
Because some patients just rely on massage and stretching, but those are just temporary relief.
Yeah.
If you don't strengthen, you're just going to keep coming back. Yeah.
So what do you find most fulfilling about being a physiotherapist?
What's the most fulfilling? When get paid, yeah. That's
when you
one.
see a twitch in the muscle.
Yeah, get paid, and also when you see like patient really feel good after the session, like no pain at all. I mean, not every time you're gonna feel like you're gonna get instant, feedback.
There are cases where they don't really respond well to our treatment also.
But when it does, you feel really good about it. Yeah. Can really see the difference also in terms of the movement and the pain.
Yeah, because I think a lot of our patients, when they come in, they expect us to just treat the pain, and once the pain is gone, they just cabut, they don't come back anymore. So I think that's a very common misconception that once the pain is gone, it's done. A lot of times we have to do the maintenance work after that, the rehab work.
Yeah, that's the important part.
That's why I always tell my patient also, that one's very important to prevent the pain from coming back again.
What if you do?
Injury from pickleball.
Yeah, I think this year a lot of pickleball injury, really. Not only just knee, I think knee, back, elbow.
Ankle, everywhere. But
Everywhere.
It's all because of pickleball.
And all ages are not just young people, old people also. I think just the nature of the sport, like from what I know about pickleball, is there's a lot of bending down and there's a lot of pivoting, fast pivoting, and that can actually put a lot of strain on the knees as well.
Have you tried before?
I tried before.
No.
Oh, have you tried
Because
before?
no. I feel like normal people, everyday people, they are never conditioned their body. So when they move surprising like that, it's gonna cause injury.
Yeah, because a lot of pickleball, they do pickleball for the trend, right? Because now everyone's doing it as a social activity.
Yeah.
So people that are very sedentary, that don't exercise at all, suddenly they are doing all this type of movement, which their body are not conditioned to, which can lead to this type of injuries happening. So for chiros, usually we see a lot of patients with back pain and neck pain, and it's not something that is trending recently. I think it's been going on for a long time. It's just that now that a lot of people are having more awareness on what they can do about it. Because initially when I first started working as a chiro, a lot of patients come in thinking that it's normal to feel this kind of pain because of their lifestyle. Yeah, but it's something that we should address it at its initial phase before it becomes something more severe. So nowadays I'm seeing a lot of patients, even young ones. I think the youngest I had was 23 years old. They already have a neck cervical slip disc from computer work. Yeah, very young, usually a bit later stages. Yeah, so imagine at 23 years old, you already have constant pain in the hands. That's something that is very detrimental to the life. So it's very important when you have any discomfort or neck pain, back pain, it's good to address it before it becomes something worse, something more severe. So neck pain and then sciatica, slip disc, very common nowadays. Because a lot of us now, we are sitting a lot, traveling a lot, stuck in traffic. Yeah, so all this can contribute to this type of conditions. And just try to get your body to move first. I think the easiest one you can do is just go for morning walks. Just try to keep your body moving. Don't try to stay in one position for too long. And then it would be good if you can take up a simple and easy sport. I think a lot of people can start by just doing a bit of core conditioning exercises, simple strengthening. At home exercises you can do also. Yeah, and then try not to sit for too long. Every 45 minutes, stand up, walk a bit. That'll be good. How about you? What do you think?
I feel like neck pain. Because again, like what she said about how their lifestyle working patterns or that, they tend to, face the computer, use the phone nowadays, the neck is always forward and down. Shoulder is always rounded like that. So everyone is like that. So so yeah, because of that, neck cases is quite common as well.
So if for a patient that comes to see you for physio, how's the treatment like? Usually the flow of everything.
Okay, so how the flow is first thing, we're gonna ask a lot of questions to the patient. just to understand the what's going on in their life and what's going on with the pain they are currently having and the issues. So from there, we do some observation. We see the body and then the movement also. What's like the affected part, we see how it moves, and from there we do a test, like the orthopedic test, special test, to rule out any diagnosis, and to see also with the special test we can confirm like what's the diagnosis also lah. So from there we figure out what's going on with their body. So from there we plan the treatment lah. Yeah.
And when you plan the treatment, are there phases to it? Like phase 1, this, phase 2, that, phase 3?
We do have phases, but for me, I rarely follow it. I don't follow the phases, I follow the patient's progress.
So your treatment is usually quite personalized and catered towards their condition and their lifestyle.
I mean, the phases, you can just, it's easy if you break the phases down for patient understanding. But when it comes to treatment, again, I determine how the patient progress themselves. Yeah.
So usually, for people that don't know usually we split into 3 phases. Very simple. First is pain management phase. Main goal is to reduce the patient's pain. Second phase is the rehab phase, where they start to do a bit more strengthening work on the muscles that are compromised or weak. And then is the maintenance phase. So maintenance is, to simply put, is where patients come in on a routine basis, either once a month, once every 2 months, depending on their lifestyle. Where they come in, we just do a thorough check to see if there's anything that is could be functioning better. Yeah, main goal is to prevent future issues lah. So okay lah, just a few to wrap it up. We'll just do a few rapid fire questions. Okay? No need to think one. Just shoot only.
Just shoot lah.
Yeah. Okay. What's your favorite post-workout meal or snack?
Okay, I cannot just shoot. Whatever my mom cooks. Whatever my mom cooks. I don't have any like proper diet plan or anything. Whatever my mom's cooks, I just eat.
Okay. Alright. Describe yourself in 3 words.
I would say I'm quiet, an introvert person, and a outdoorsy kind of person. I like to go outdoors. Yeah.
1 word to describe your experience in Relief so far.
1 word.
Working with the team.
No stress. 1 word. Sorry.
It's okay. Stressless.
Stressless.
Okay.
Single or taken?
Huh? Oh.
Single or taken?
Complicated. No. Single. Single.
Okay, last one. If you could treat 1 celebrity, who would it be?
1 celebrity, Malaysian or
any
celebrity, or having
sports
any
person
interest?
or anyone that's famous?
Okay, sport person. If like a Muay Thai athlete any Muay Thai athlete I'm good with. Yeah, the One Championship one, like Rotang and stuff like that. I would love to treat them.
If you could give yourself, your younger self, 1 piece of advice before you start work, what would it be?
Just calm down and go with the flow. No need to rush, because back then I keep on rushing things, like want to learn more. But just take it slow.
That's true. I feel like the best teacher is experience. The more experience you get, then the more things you see, and the more you know how to handle certain things. I think that's about it for today. Thank you guys for tuning in. Thank you, Zul, for making the time to come here. If you need cupping therapy, if you're interested to learn more about what physio is or what he can help you with, then feel free to drop by Relief Chiropractic. Okay, bye-bye.